I think regular healthcare is especially important for the retired dogs because they have been through so much, they've provided so much for us, right, as service dogs. They deserve to be treated with respect even once their career is over. And so I think I guess it's an honor-based thing. I mean, they've done all this for us. We should now provide them with peace and comfort for the rest of their lives.
Just like their human counterparts, there comes a time in a police dog's life when they must go and retire and enjoy some rest and relaxation. Working dogs are owned by the City of Salem, so when the decision has been made to have a dog retire, the city allows canine officers to have the option to purchase their partners from the city. Their continued health care is now the responsibility of the handler, and because of the type of work these dogs have done for the majority of their life, care for the dog may be a little bit more than the average house pet. Let's meet some experts that know about caring for these dogs both during their career and retirement.
Hi, I'm Dr. Rob Siefken from the VCA Salem Animal Hospital. I am one of the ER doctors here. I think probably my favorite thing about working with these police canines is actually getting to know both the canine and the handler. And you really see a difference in personality between each police dog too. I enjoy working with the dogs as an individual basis and the handlers too.
I mean, these are partners, they work together, they know what each other's thinking, what the other one's gonna do. It's just amazing to see what they will do for each other. I'm Dr. Chris Halden. I'm a general practice veterinarian here at VCA Salem Animal Hospital. And I've been working with the police dogs for, I want to say, about 15 years. I also get to see a lot of the partnership and the bond that the dog and the handler have. That's to me really probably the most amazing part of it all is the bond. It's a true partnership, a working partnership. And these dogs will go all out to do their job and to work with their handler to get what needs to happen done, even to the point of injuring themselves sometimes or being injured in the process of it. I mean, these dogs have a tremendous drive, and that's probably one of the big things that distinguishes them from our average pets. From a medical perspective, some of the things that we'll be aware of or looking for dogs entering retirement, for a lot of these dogs, it's a good thing. They're not having the same type of physical high impact demand on their bodies that they had when they were doing patrol work. So honestly, a lot of the orthopedic and day-to-day wear and tear kind of pain concerns lessen, and then we're managing more typically kind of long-range, big picture arthritic type pain.
So they tend to have an especially important need for long-term management of diseases that we see in athletes.
They do a lot of mouth work, bite work, so they often have very particular dental needs or a higher risk for special or certain dental injuries and needing dental intervention. I'd say that's maybe a less frequently recognized aspect of their care. These dogs, we're looking on the outsides of their bodies. Hopefully we're looking periodically at the insides of their bodies with blood samples, urine samples. That way we can better address changes that may be happening with age, with time, and we can individualize and tailor their care to their needs.
They've done so much for us. Don't you think it's time to help them? Consider donating to the Salem Police Foundation's Retired Canine Health Fund.